Okay, I'm going to go ahead and call the meeting to order. There's 4 of us and there's 8 on the committee, so we're good to go. And I would imagine the sheriff's close enough, he can get in here yet still, but I don't want to waste the rest of you good folks' time. So call the meeting to order at 9:11. The open meeting laws have been met. It was posted. Have an agenda. Looking for a motion.
Motion.
Okay, motion by Aaron. We need a second. Do we need a second to approve the agenda?
I'll second it.
Second by Dustin. All those in favor say aye.
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 Aye. Thank you. You had minutes sent to you already from last meeting. Looking for a motion for action on the minutes. Is there a motion to approve?
Since I wrote them, I'd rather. Thank you, Aaron.
Yeah. And a second. Okay, so Aaron, did you make the motion?
No, Dustin did.
Dustin, okay. Dustin made the motion and Aaron the second. Okay, all those in favor?
Aye.
Aye. Opposed? Okay, the minutes are approved. Aaron, public health update.
All right. Couple of things. Everything's pretty bad still. Last week I think we were at 230 was the case rate. We're at 170, so it seems to be going down. Although the hospitals are still triaging the people who they test and saving those resources. And this does not include antigen positives, and we're not recording any at-home tests that anybody is reporting to us. So that number's very likely smaller than the actual. I'm not sure it's a good metric anymore. But we're at 170.6 for case rate. Think that's low. There were 354 new cases last week that we know about. Looks like, unfortunately, we were up 1 fatality last week from COVID. We are there have been 2 hospitalizations in the last week, and current active cases is 355 that we know about. Vaccination clinics we have scheduled for the next 6 weeks, every Tuesday and Wednesday in a different community. Next week Tuesday is in Arcadia from, I think it's 1 to 7, and Wednesday is from 3 to 7 in Whitehall. They can do any version of a COVID vaccine that is needed. So those continue to get folks going, although we might start looking at talking about an end date in the next month or 2 for those. Testing options, there's an additional testing option in the Galesville Pharmacy, long-term care pharmacies. They're doing some COVID testing at the Gale Town Hall on Mondays, Tuesdays, Thursdays, and Fridays from 9 to 10:30 by appointment only. And we have their information. You can go to our website and Facebook page to get that information to book an appointment with them as far as testing goes.
Okay.
I think that's it.
Okay.
Well, and I'll also say we put out a press release that got a lot of media attention last week. We're not there. There are too many cases for us to contact everybody. It's not even close. We couldn't even try if we wanted to. So we're contacting from 0 on up through 18, just the minors, to let them know and their families know what their options are, since they typically are in school or in congregate settings and stuff, or daycares, and have the least ability to distance, I guess. And then if we get to 18 plus every single day, or if we get to 18 every day we're starting from 100 on down. So with the oldest folks on down, and we're calling them, and we're getting to as many as we possibly can in a day, and then we're starting fresh every single day. So
Okay.
I think we might be the first people in the state to say that we couldn't contact everybody, but nobody can contact everybody. We're just the only ones that said it out loud.
I said it out loud.
Correct.
Any questions? Okay, let's move on to number 6, the discussion, review, action on new and existing COVID policies. Last meeting, we had said we were going to kind of change some wording to reflect current CDC guidelines. So Aaron, where are we at?
Well, I think that was an HR thing, and I think that Krista sent those updates out to the entire staff to change for the current CDC guidelines, and there have been no changes, and I don't know that we anticipate any major changes in the foreseeable future with
Okay.
COVID. There's been a lot of movement in the last 2 to 3 months, but I think we're in a good place to where we think it's going to stay pretty stable as far as the guidance goes.
Okay. Yeah, I guess that's what I was curious if was really going to actually ask that, is if it looked like it would be changing or if this was going to kind of settle into the normal.
Nothing that impacts the county. I think they might come out with some. I think we're anticipating them coming out with amending some school guidance, but we don't know what that's going to look like. We never do until we know when everybody else knows.
Okay. All right. Then B, precautions, preventative measures for county facilities and staff. I think currently we've got highly recommending masks. Do we see that we need to make any changes, any movement in that? Okay, I'm not hearing any conversation in that way, so.
Well, Sally, I'm the only one talking, but it's a little frustrating to like the board of health meeting, every single person except for, I don't know, 2 or 3 without a mask in a relatively small space sitting next to each other for a period of time. I know that I went to another meeting internally in the Trempealeau room, and it was 10 or 12 people sitting right next to each other without masks for an hour and a half about their problems, and it seems preventable. It seems like an unnecessary risk to take when the meetings can easily be virtual, and I just expressing my frustration that I wish more people would take that opportunity to take advantage of the virtual meeting.
Well, I did make a pitch for it at the county board meeting, and I did have to attend in person for another reason, but yeah, mask the whole time. A handful of people that were wearing a mask, but yeah, did definitely when it came to the COVID committee report, I did encourage them to have remote meetings, wear masks, and self-chastised us for saying, and here we are in a room full of people. So, the county board, they can only be advised. They can't be told. So, but yeah, I know what you mean. And I am concerned at some of the technology issues that have happened, but I have tried to figure out, like with the Board of Health meeting where with Beth and I unable to call in. And so, reached out and figured out what, asked them to figure out why that was happening. Unfortunately, it only takes one of those incidents to get somebody to say, some person goes, see, it never works, when it was maybe the only time. But that was the justification that they needed to.
I will share that WebEx is the platform that every single healthcare institution uses for their platform, and it seems to work just fine for them. So if it may be, I don't think it's a platform problem. I think it's a user problem. Not you necessarily the user, but Trempealeau County, the user.
Yeah, there's obviously, because if it was my default position is, yeah, pilot error. So I do tend to, do that. But when there's two of us and we're both experiencing the same things, then I thought, well, that's the second time that happened. But so far after that, I haven't really had an issue. So it might have been that particular meeting or something. But I agree about the need for more remote meetings. That's why I do always ask that this one be done remotely. Okay, any other thoughts, conversations on the measures, preventative measures, cautions? Okay,
I do have a
letters.
question. Did I read, because I apologize, I wasn't at the last meeting. Did I read that if people are out for COVID, they have to provide evidence to HR to return to work, that they're cleared?
That's what HR wants, but I don't know how they'd get that evidence, especially with the at-home test situation. We wouldn't be able to provide that. We're not doing that for any other folks. Just with the volume of the request and the at-home test hospitals. So if I have a family of 5 and I test positive and then my wife and kids get sick with the same symptoms the next day, the hospital's not going to test my wife and kids. They might point us towards an at-home test or an antigen test, but they're going to tell us to just follow the same rules that I would be following as the actual validated test.
Yeah, I just want to know as a department head what I should be requiring my staff to do. And I thought that was a new piece, and again, I wasn't part of this conversation, so I kind of wanted to have a better understanding what that was about.
So I think now that I'm talking more, they were asking for if the health department would say that an at-home test was valid, and the health department would not say that. But as a department head managing my own staff, if I had somebody with an at-home test that had a positive, I would take their word for it that was true, because there aren't options otherwise to get test or to get proof.
I think too, the conversation was also what some department heads were going to Krista and asking her what part of the test she should take. And basically what the conversation was is she didn't want to be responsible for interpreting medical reports or determining whether somebody's anything to do with the medical piece of it. And so rather than it having to be, it was that it would not go to the health department for, that we wouldn't involve the health department, and that we would not, so I'm trying to remember, but it was kind of more specific to that that HR not be suddenly involved in medical aspects of this, that whether it's, a department head says, is this person safe to come back to work? They've been, they were diagnosed 5 days ago, and they don't have symptoms anymore. What Krista was saying is, I don't think I should be the one to be answering that question. And then, yes, it was, don't send it to the health department. That's not their job to be doing that. And so it was that employees would need to basically kind of what Aaron said, if there's a positive when they're home, then they need to communicate that they're not able to get tested because there's the assumption that they've got it. But yeah, that's basically what that conversation was not that they would be reporting results, but that HR would not be involved.
I thought I had read that there was a requirement that staff returning from having been out with COVID must provide that they're cleared to HR. And I just wanted to be clear what that was and understand what was behind that.
Well, the minutes say from what Krista was going to put in the guidance, that it's up to either CDC guidelines, the guidance from the health department, or their own healthcare provider before returning to work. It's nothing about reporting back to HR.
Okay, I'll look at that. I may have read that wrong, so I apologize if I'm asking a question that isn't pertinent.
Yeah, and I had closed the minutes again, so I couldn't find it. But yeah, what it was, yeah, Dustin pretty much just summed it up. Yeah, that it not be up to the human resources to be determining that clearance, but yeah, that a doctor, that a medical professional make that clearance. Or yes, in the absence of that, then they follow the CDC guidelines. And I think the question had come down to, yeah, employer, department heads wanting to know when an employee could be allowed to return. So, yeah.
I'll look at that policy she sent out again and make sure I understand it. Thank you.
Okay, yeah. And if it does feel unclear, then we need to, refine the wording a bit. Okay. Any other questions? Okay. So, any other things that we want to add to the agenda for the next meeting? Okay. Then let's set the date for the next meeting, which would be okay. The next meeting will be February 11th. Does that work for everybody?
Can we make it the 10th?
I cannot do it the morning of the 10th.
This is from 9 to 10 usually. Okay, never mind. I can do the 11th.
Okay. Does the 11th work for everybody else?
Yeah.
Okay, then we'll see you then. Obviously, if anything comes up and we need to have an emergency meeting, we will do so. All right, thank you everybody for being here. Have a good weekend.
Thanks.